Good days, ladies and gentlemen. My name is Chan Geng Hui. I am one of the students from Bachelor of Psychology with Honours. Today, I am doing a video presentation for my subject. My subject name is Clinical Psychology. This is my course code ABPC1103. If you'd like to know more information about myself, you can stop the video and then see my IC number is here, telephone number, email, and I'm one of the students from Open University Malaysia at the Petaling Jaya branch. Today, my topic is about the ethics and professionalism in community psychology. Before I go into I go into my topic, I want to do some introduction about psychology. As you all know that psychology is a scientific study of the human mind and behavior, including how the mind influences behavior and how it works. Sometimes we not only even study the mind and behavior of a human. There are some study that also study the mind and behavior of animal also, but we can leave that for another days. In the field of psychology, there are many branches, including clinical psychology, abnormal psychology, and cognitive psychology. In the psychology field, one of the most well-known occupation is therapist. Therapist is an occupation well trained and recognized by the relevant authority to provide treatment in curing mental illness. Of course, you need to undergo some training and being recognized by the government. Mostly is psychology association before you can call yourself as a therapy and give therapy treatment to other mental illness patient. There are many type of mental illness such as anxiety, depression, behavioral disorder, and psychological disorder. Not only in the psychology field, I believe in other fields such as doctor, teacher, and and IT field. In psychology also, we have our own ethics and profession to be followed, such as confidentiality, maintain as a neutral party, maintain our competence, and maintain our relationship with between the patient and the therapist. Okay, I will start with the first ethics, confidentiality. As a therapist, we have the responsibility to protect our patient sensitive information. This is because when a patient come to you, they trust you. That's why they share their most sensitive information, darkest secret to you. Sometimes this kind of information, even the patient will not share to their friend or family member. Because not only because the patient does not trust them, they worry about like what if they suddenly leak their secret out? What if they cannot be trusted? But psychology is different. We have our duty to maintain our client confidentiality. Psychologists are obliged to keep their patient personal information. But under certain special circumstances, the therapist sometimes can break the confidentiality to the unless like the patient is telling them, I want to commit a crime, I want to rob a bank, I want to hurt somebody. Like this, under these circumstances, the therapist can share their patient sensitive information to the law enforcement to prevent their patient really committing the crime. Or suddenly the therapist receive an order from the court or the law enforcement demanding their patient sensitive information. Like that, it can be forgiven lah. It's not like the therapist is purposely leak out their patient sensitive information, but because this kind of sometimes it's being requested by the law, or because the situation is different or unique. The second ethic is maintain as a neutral party. As a therapist, we should treat all of our patients in the same way, regardless of our gender, religious, education, or background. I believe we all human are the same. We are all part of our society. As a therapist, we should provide equality to all of our patients. Ethical practice require cultural competence intervention that respect the uniqueness of different community. Every religions have their own uniqueness. They might be different from us, but that doesn't mean they are wrong. They are wrong. Just that it's different. I believe they have their own reason to maintain those type of culture or knowledge. Ethic number three, maintain your professional competence. I believe not only in psychology field also, in other fields such as medical, information technology, or teacher, from time to time, they will learn something new, new knowledge, new technique, or new research. Maintaining a high standard of professional competence is crucial because we will encounter new situation every day. What if our old knowledge or old technique doesn't work? We will have a big trouble like that. We can be aware of the latest research like done by other college or expert in psychology. We should ensure ourselves is updated with the latest standard and knowledge. I believe there's no harm in learning something new also. It can increase your own self-value and help your patient someday. We can always learn new technique, knowledge, and ethics guidelines set by the American Psychology Association. I believe all the psychology experts in the world, they will always refer back to the standard or ethical guideline that is prepared by the American Psychology Association. Even in our coursework also, we are being ordered to prepare the reference following the standard of the American Psychology Association, in short form also known as APA standard. Ethics number four is to maintain a relationship between a therapist and the patient. The therapist always should maintain boundary between the therapist and patient. They should limit their identity between therapist and patient. The therapist should avoid any intimate relationship with their patient. Of course, that includes no sexual or love relationship with their patient. It is highly unethical if the therapist is having a loving relationship with their patient. If this kind of relationship are being discovered by other people, the therapist could get their license suspended. Of course, we always say that we should do our best to avoid giving therapy treatment to our friend, family, or non associate because it will be hard to maintain the neutral party as you already know their personality, habit, sensitive information. If you think like, what if the advice you give to them, you injured your relationship between you and your friend? How are you gonna face your friend after the therapy session? Will it injured or jeopardize your relationship? After studying all those ethics, they have influenced my approach to ethical decision making in community psychology. First of all, maintain confidentiality is very crucial. In if next time I want to leak my patient sensitive information to other people, I need to think before like can the these people or this person can keep the secret? Should I leak to them or I should keep it to myself? Unless the other people also is an expert in psychology. I believe they understand the crucial or importance of maintaining confidentiality. The second one is I believe all the patient and all the person are the same. No one should be treated unequally. I understand that especially in Malaysia, we have different culture, different religions. We are well known for that. But we shouldn't be looking down or looking down at other people also. I believe everyone is the same, regardless their religious or culture. Being a therapist, I highly advise that we should give therapy treatment to unknown associate to maintain as neutral party. If you don't know this person, then you can give him advice because after the therapy session, you don't have to meet him anymore except the next therapy schedule session. But if you imagine the patient is your friend, how you gonna face him after you give him some advice? What if the advice you give to him will jeopardize his feeling, and and then your friend might doesn't like to hang out with you anymore because they share their secret to you, and then like, they will thought like you look at them differently, and then learning new knowledge or method can help our patient better, and also increase our own self value. In conclusion, being a therapist is not easy. Not only because like in the physical diseases such as fever, diarrhea, or cold fever, they can always be cured with the correct medicine. But for mental health, it's different. You might give the same advice to the same kind of mental illness, but sometimes it doesn't work because everyone have their own mentality, habit, and personal value. What if the advice give to them like is actually normal, but for them like it doesn't align with my personal value? I don't like this therapy. It's not a good therapy. He might not tell you, but in his mind, always feel like that. But sometimes we kind of be struggle between being a friend and therapy. What if you know a friend is having a mental illness or mental health problem? You can help them, but as a in the ethic, it's highly advised to avoid give therapy treatment to your friend, family, or not associate. I believe that not only in our psychology field and other field also, many ethics need to be followed to maintain our career and do our best to help our patient. So I thank you for I wanna thank you for your time and have a nice day.